Rheumatoid arthritis or RA is an autoimmune disease. When the body's immune system attacks body's normal cells, we call it an autoimmune disease. In rheumatoid arthritis, the immune system commonly attacks and destroys tissues of the joints. However, in up to 25% of patients, other organs like thyroid, cardiovascular system, respiratory system, liver, eyes, etc. can also get affected. Another aspect is, in autoimmune disease, patients like RA, the possibility of developing other inflammatory diseases like allergies and cancers are also high. Normally, the medication that are taken lifelong like painkillers, immune system suppressants or modulators like steroids, disease-modifying agents, DMARDs, biologicals, etc. can cause various side effects and increase the possibility of developing other diseases like hypertension, diabetes, heart disease, obesity, etc. Health tips are not the focus here. Rather, the effort is on providing information that will help you to understand the causative factors behind this disease, measures for early detection, investigations to assess the impact of disease on different parts of the body, available treatment options in the modern medicine with their benefits and limitations. The goal is to help you understand the relationship between the disease and the lifestyle factors. More importantly, to understand the impact of lifestyle correction on reversing the disease process and preventing recurrence. Those who are on medication should remember to reduce or stop medicines only under medical supervision. When we talk about a joint problem, especially rheumatoid arthritis, we should have a basic understanding about how a joint is made. So, joint is actually to connect the bones and to make the body flexible. So each joint will be having a joint capsule and a joint cavity, and the cavity is covered with a synovial membrane. That is synovial membrane, that there are cells which is secreting the fluid which is lubricating the joint cavity or the movement, make it more flexible and the functioning and the movement, and make it easy for the joint to move, body to move. When we come to the symptoms of rheumatoid arthritis, what are the symptoms? Basically the pain and stiffness of the joint, and also the edema, and sometimes redness also will be there, and most of the patients will be having a low-grade fever also. In rheumatic fever, that is another autoimmune disease which is affecting the joint, there the fever will be high. But here the low-grade fever may be there or may not be, the patient may not notice it, but the pain will be and the stiffness will be the major problem. And around 25% of the patients, the other systems can also be affected. If the liver is affected, there can be indigestion and other problems, and the lungs is affected, breathing difficulty can occur. And if the eyes can be affected, that there may be pain on the eye, and so any other system also can be affected because it is an autoimmune disease. Next, when we come to the diagnosis, symptomatically we can, when the joint pain is there, definitely we can think of it can be a rheumatism or some arthritis is there. Then to confirm or the final diagnosis whether it is a rheumatoid arthritis, we have to check the, one is blood count, CBC. Here the count, blood WBC count may be very high, and many of the patients can be, especially if it is for a long time, 10 years or the disease is there, the RBC, that is the red blood cell count, can go low also. And next is ESR, erythrocyte sedimentation rate, that will be high. And the CRP and HSCRP, these are actually inflammatory markers. CBC, ESR, HSCRP, HSCRP, etc. are inflammatory markers, those will be increased. And then when we come to the specific diagnosis, are autoimmune antibodies like RA factor, anti-CCP, those will be increased. And another autoimmune antibody usually checked is ANA, that is anti-nuclear antibody. There are around 17 types of anti-nuclear antibodies are there, and many of them can be positive also in this. If the ANA is positive, we will take it as the systemic involvement. Not only the joint is affected, other things, systems can be affected. So then we will call it, if NA positive, we will take it as an SLE, that is systemic lupus erythematosus. Then another test usually has to be done is ASO titer. ASO titer is a anti-streptolysin O antibodies, that is actually antibody against a bacteria called streptococcus. That is, streptococcus infection can be very common in the oral cavity, especially the caries, teeth problems, or the gum problems, and the tonsillitis. So, if there is a chronic infection with this streptococcus bacteria, this body will make this streptococcus anti-streptococcal antibodies, and our body will this cross react with our joint protein and also the heart, this Weil's syndrome. So it can also get affected. So it is very important if they checking the ISO titer, and if there is that factor also is there, to correct with the antibiotics, and if the caries is there, the correct the caries or tonsillitis or whichever infection has to be corrected also. Next is generally speaking is generally tested is an HLA-B27. That is to check for any mutation which is predisposing the patient for the this rheumatoid arthritis. If the parent, mother or father or the other family member is having rheumatoid arthritis, that is always better to check HLA-B27. And if it is positive, the predisposition for the disease is high, then we can take care that even though there is, if you have a genetic predisposition, you need not get the disease. There are so many other factors playing, like epigenetics. So epigenetic factors can be altered with a healthy lifestyle. If you can, even if the HLA-B27 is positive, you don't have to worry. You concentrate on living a healthy life so that the epigenetic factors can be altered to your favor. Next, when we go into the depth of the disease, this is an autoimmune disease. Here, the immune system, our own immune system is attacking our own joints. And what type of patients can get? Definitely familial history and the HLA-B27 or any genetic predisposition. If you have, you can get the disease. Next is your lifestyle. If you are having even HLA-B27 negative also can get rheumatoid arthritis. If your lifestyle factors are against it is not healthy, then you can get the disease. So because even if the genetics HLA-B27 positive also, if you are leading a healthy lifestyle, you will not get the disease, because there is so many more than that the genetics, there are so many factors which is switching on and off the genes. So that is together we call it epigenetics. So these epigenetic factors we can modify. Next is what other diseases which predisposes or the comorbidities along with the rheumatoid arthritis. And usually this metabolic syndrome, that is obesity, diabetes, hypertension, dyslipidemia, that is high cholesterol. This is called a metabolic syndrome. The patients with this metabolic syndrome can get the disease. The chance of getting this rheumatoid arthritis is very high. And or this, if the patient is already on medication for the rheumatoid arthritis, they're taking this steroids and all the anti-inflammatory agents, is all weight gain. The possibility of weight gain is also there, and also many these medications can multiple ways it can affect the immune system, and these other diseases also can coexist, or adding up of diseases can come. And next is what are the complications? If the disease is there, then what is next going to happen? The joint will be damaged and the joint fixity can occur. That is the major damage. So you will be mobility and the flexibility of the person will be reduced. So many will be find it difficult to do even the ordinary work, and even some people, when the hand is so deformed, they can even take food. They won't be able to take the foot. And moving, if the leg is affected, walking and movements and all will be affected. Even hand, it depends on which part of the joint, which all joints are affected. Next, because of this, if there is an autoimmune disease, especially rheumatoid arthritis is there, the other autoimmune diseases can come, and also the cancer. The cancer possibility is very high for a person with autoimmune disease, any of the autoimmune disease. But usually, part of the country, what we are seeing is the most common is thyroiditis, Hashimoto's thyroiditis. It is very common that either the thyroiditis came first and then the arthritis comes. Rheumatoid arthritis come first, and then after a few years the thyroiditis come. And many of the patients who reports with the cancer also will be having any of this autoimmune disease also, which was presented first as presented as this autoimmune disease, then goes into cancer. Next, what are the investigations it has to be done for this rheumatoid arthritis patient? For the diagnosis part, this inflammatory markers and the autoimmune antibodies that we have already discussed. Next is what are the impact of the disease on the body. For that, we had to check for the body parameters like the weight, body composition, fat percentage. Usually, these patients will be having the muscle and bone will be reduced because they are not doing, because of the pain, they are not doing much physical activity. The body composition, fat will be high, and the body muscle and bone mass will be reduced. And also because of the disease and the disease progression, or the kidney and the liver can be affected because of the disease, and also because of the chronic medication. So we had to check all the organ functions also. So investigation should be directed to what is the impact of the medication on the body, on the other organ, and also what is the impact of the disease or the autoimmune process, whether it is affected other organs also. Next is treatment. So when we come to the treatment, is modern medicine treatment is always directed to symptomatic relief. So in this case, the pain is the major problem, and the fixity and stiffness of the joint is the major problem. So to prevent the fixity, that is to maintain the flexibility of the joint and relief of the pain is the main direction. For that, the pain relief, NSAID, that is non-steroidal anti-inflammatory medicines, and that is the first line of management. But rheumatoid arthritis, it may not be effective. So we'll start, usually doctors will start steroids. Then DMARDs, that is disease-modifying agents, like methotrexate, sulfasalazine, leflunomide, hydroxychloroquine. There are so many, I'm not going into the details. And next is the biologicals, the later generation of the medications. The TNF inhibitors, that is tumor necrosis factor inhibitors. So it is antibodies, we are actually blocking the tumor necrosis factor in this many of these modern medicines like certolizumab, adalimumab, infliximab. So it's ending with the MABs actually, it's monoclonal antibodies. So actually what they are doing is to blocking the tumor necrosis factor, that is actually protecting you from the cancers. So when our body, always the cancer cells are developing because of the DNA mutations and damage, the cancer cells can come and it will be destroyed by our immune system. That is where one of the major factor which is playing is tumor necrosis factor inhibitors. But we are blocking this tumor necrosis factor inhibitors, so it will give definitely benefit for the pain relief and all. But the problem can be the chance of getting cancer cells will be high when we are on this medication for a long time. Next is other rituximab, tocilizumab, and there is ILX. There are other inflammatory markers or the cytokines like interleukins, different interleukins and antibodies against that. That is called actually biologicals, or one of the group of DMI, disease modifying agents. The problem with this actually, all this medication, so it can, what is the benefit? It can relieve you, definitely with much relief can be there. But what I am saying is, usually I am seeing the patients who are already on this rheumatology type of treatment or all these medication. But many of the patients, actually they will be starting with 1 or 2 medicines and adding and adding. And then they may be taking 4 or 5 group of medicine itself, and finally the biologicals also. But even with that, the relief of symptoms and the normal activity may not be possible for many of the patients. But some are able to manage, but some may not be able to manage. So adding up for medicines, and they will be finally, because of this anti-inflammatory medication and the steroids and all, they will be ending up with the diabetes, hypertension, obesity, etc. And they will be having that medication for those medicines also. So the side effects and of the medicine and it's not able to achieve the symptomatic relief is the problem actually. Next is, what are the role of surgeries in this rheumatoid arthritis? Basically, surgery has a very limited role in rheumatoid arthritis. We can repair of the ligament tear or something like that, or this joint replacement. If the fixity to joint is totally fixed, then the joint replacement surgeries or joint fixation surgeries also is done, but having only very limited role. Next, when we have discussed different aspects of the rheumatoid arthritis and the treatment and its limitation and the surgery's limitation, then what is the real solution? Basically, what we had to understand that early diagnosis, one aspect. Early diagnosis and stop the disease progression. That should be our aim. Many of the patients, if their hands are affected in the initial stage, they'll be knowing it and they'll be taking medicine. But I have seen many patients who is having deviated toes, but they are not recognizing it that they are having rheumatoid arthritis. They may be having some joint pain and all, they'll be going along with it. But after major deformity only, they'll be even knowing about it. And especially the foot, the great toe, if the alignment of the great toe is lost, then also we should definitely think of whether it is a rheumatoid arthritis. Then what we can do, this early diagnosis, and also when we are reversing the comorbidities, diabetes, hypertension, all this, even the rheumatoid arthritis and the diabetes, hypertension, which is usually occur with the rheumatoid arthritis, all comes under the lifestyle disease. The correct lifestyle modulation, if it is possible, that you can get rid of all these diseases. You can reduce the medication, not even actually will be able to come out of medication also with the proper lifestyle modulation. To basically the lifestyle modulation should be directed actually to give optimal nutrition, optimal physical activity, to achieve optimal body composition and blood parameters. It can be, if it is initial stage, the patient himself may be able to, himself or herself may be able to do the correction, do the physical activity. If you are obese, bring down the weight, or avoid this colors and preservatives and all, especially in the form of food additives and cosmetics, etc. And even the perfumes. So many unnecessary things we are using, and it is all toxic to the body. And definitely all the medication, the body considers it as toxin. If you are taking medication for the diabetes, hypertension, all, if you are willing to do the correct lifestyle modulation, you can come out of those medication also. So, but if a patient who is taking so many medicine, 2 or 4 or 3 or 4 or 5 medicine for the rheumatoid arthritis, and then there is pain is continuing, and also there is a heart problem or diabetes or hypertension, then you may not be able to do the lifestyle correction by yourself. Then you have to take a clinically supported lifestyle correction with an expert. In short, the primary trigger of the imbalance in the pro-inflammatory and anti-inflammatory activities of the immune system are the anomalies in the lifestyle. This imbalance causes the development of rheumatoid arthritis and other autoimmune diseases. The diagnosis of disease which develop from the imbalance in the immune system and the reversal by regaining the balance in the immune system is the best way of preventing damage to affected organs and stopping the spread of damage to more organs. To overcome RA, attention should be paid to 4 most important aspects. First, reduce the entry of toxins into the body through air, water, food and body care products, and remove the excess fat deposit and toxins in the body. Second is to identify food and environmental factors that are allergic or intolerant to the body and avoid them. Third is to ensure optimal nutrition for the development of healthy new cells to replace the diseased cells in the body. Fourth, ensure an optimal omega-3 to 6 fat ratio around 1:1 in food and stored fat in the body, as the immune system activity is controlled by this essential fat. Next, let us understand what is clinically supported and supervised lifestyle correction. In this, the first step is to understand your body parameters by assessing body composition, the lean mass fat mass ratio, body age, fat status, etc. Second step is to evaluate the current status of your organs like a heart, blood vessels, liver, kidney, pancreas, hormones, immune system, toxin level, nutritional status, etc. And also to find out the most suitable food for your body and what to avoid. Third step is to identify what lifestyle modulations can help achieve reversal of the disease process, attain desired body composition and normalize blood parameters. Based on the patient's parameters, effort is directed to provide optimal nutrition, physical activity, and reduce toxin level. The focus is to create an enabling environment to balance the metabolic activities at cellular level. In most patients, even those on medication for many years or advise surgery for lifestyle diseases like diabetes, hypertension, heart disease, arthritis, autoimmune diseases, cancer, allergies, etc., can prevent progression of the disease to some extent, reverse the damage, and come out of most of the medications within a month, and avoid surgeries provided the patient is able to correct lifestyle before the organs are irreversibly damaged. Next, let us see the changes in the disease condition of patients who have undergone clinically supported lifestyle correction. The first patient is a lady who is 62-year-old and height is 157 centimeters and weight is 66 kg. And she is suffering from arthritis for the last 20 years and hypertension for the last 2 years. And she is suffering from allergy from the childhood onwards. She is actually taking so many medicines, actually 4 tablets. That is one of the tablet for the TB, 4 tablets she is taking for the 4 type of tablets, or many of them are morning and evening. And 4 types for the hypertension itself. Tisar trio, that is 3 medicines, telmisartan, clinidipine and chlorthiazide, that is taking morning, and clinicon, that is actually clinidipine plus telmisartan, that she is taking, and also Concor and Moxovas. So many medicines for the hypertension. Even with so many medicine, her hypertension is not really controlled. It is, when she comes first, it is 150/100 actually. And for the arthritis point of view, she is taking Defacort and hydroxychloroquine and etoximab, toxicoxib, that is an NSAID, and methotrexate, that is an antimetabolite. And it's an anti-cancerous medicine also, and folate. So many medicines for the arthritis, and so many medicines for the hypertension, and also for the rosuvastatin she is taking for the high cholesterol value also. She is obese also. So what was the changes when she, and again she is, on the investigation point of view, she is diabetic also. Her HbA1c is 6.4. It is by diabetes to diabetes inside. ESR, even with all these medicines, she's ESR is high, and the GFR, kidney is already affected. GFR is reduced to 73. Ideally, it should be above 90. Now, the first degree, grade 1 renal failure is there. And even the sodium level is going down, uric acid is high. That's all renal function measures. So, her renal function is affected. WBC count and ESR is high. And RF factor is very high, more than 120 is there. And again, we usually check for the tumor markers also, the cancer possibility, to assess the cancer possibility because of the age, and also there is an autoimmune disease. So CL 19.9 is high, that is 55 is there. That means it's mainly for the pancreatic marker. The chance of a pancreatic cancer is there, or it can be increased in other this intestinal cancers also. So there is one cancer marker also is high, and her body tin level, that is a toxic element point of view, tin is very high, and her body is reacting with so many common food items like potato, lemon, cabbage, dalchana, and milk. So many food items her body is reacting also. Then when we come to the result, actually she was taking so many medicine. And we usually, with the clinically supported lifestyle correction, initial stage, every day monitoring. And the BP, if the patient is taking on BP, the BP will be coming down very fast. So every day we will be tapering off, because she is having so many BP medicines, tapering of medicine. And also this other steroids and other immunosuppressants also will be able to taper off very fast. And in this patient, by the day 8 itself, most of the BP medicines has reduced. By day 15, her BP medicine and cholesterol medicine were able to stop. And this by the end of 1 month, that is 30-day visit, she is not taking any medicine. and she doesn't have any symptoms, she say. That is, she has actually she has reduced to around 60 kg also, almost 5 kg reduction also. That is fat and this edema, that is body, the joint edema also is there. No? And even the diabetes that she was taking for the arthritis and this BP. And her BP is actually was not controlled with properly controlled with all these 4 medicine, but without medicine she is able to come down to 120 BP, and this GFR also increased, and the she was diabetes HbA1c was 6.4. It was reduced in the 15th day itself 6.1, and again to 5.8, and by day 60 5.4, and so she has come out of almost all the problems. And even the CA 19.9 has come down to, by 30 days it is 45 reduced, and by 60 it is come down to normal 36, and the RA factor is also reduced. By the 30 days itself RA factor came down to 110, and it was above 110, and then it is gradually reducing. So that is the result actually, the symptomatic relief and coming out of medication. The only thing, the patient should be willing to do the prescribed exercise and dietary changes. We will discuss one more patient's experience. This is a male, 46 years old, 170 centimeters height and 66 kg weight. He is suffering from rheumatoid arthritis for the last 8 years, and the symptoms is increased for last 2 years more severe. It is his own medication, but it is becoming severe. And he is taking medication for cholesterol also, and he is taking so many medicines actually for different type of medications he has tried. He is actually Malayali, but is staying in Kerala, but staying in a European country actually. He's mainly his treatment was mainly in the UK or some other European country actually, and she was taking currently so many medications he had tried, and currently when he is starting here, he is taking hydroxychloroquine, methotrexate, and diclofenac and rosuvastatin, that is for the cholesterol, and Ayurvedic medicine also. With that also he is not comfortable. He is actually going for treatment for a month, just for the treatment. And when we go into the details of the investigation, he is having vitamin D deficiency. Vitamin D is only 14, and his even with the he's taking this rosuvastatin is taken, but the HDL level is low. The cholesterol and the triglyceride is okay, but HDL level is low. And his most important thing is actually his SGOT, SGPT is very high. SGPT is 940 and SGOT is 577. That means his liver is getting affected. This methotrexate and hydroxychloroquine both can damage the liver. And even with all these medicines, his ESR is high, HSCRP is 20 and the CRP is 18.4. So that means that is not only the joints, the blood vessels, the cardiac risk factors also is there. And anti-TPO, that is actually a marker of the thyroiditis, that is also high. And RA factor and anti-CCP is very high. And he's also toxin level is very high. And so many regular food items he is allergic, or the body is immune system is working against, like a groundnut and milk, cashew, almost all the nuts, pistachio, pea, orange, so many potato, so many items, and the gliadin, that is gluten allergies. So many food items also he is allergic. Now, when he come to what was the result actually? When actually after this patient, because his liver is affected, we are given importance to tapering of the medicine very fast, and by the 8th day when he came, actually he has stopped with the methotrexate and hydroxychloroquine and all the medications we are taking, even the Ayurvedic medicines. Ayurvedic medicines also can damage the liver. So we have stopped all the medicines, but he was comfortable. Actually his symptomatic relief is there. He was given aceclofenac also for the, because he is very worried about the medication. He was given mild medication, anti-inflammatory, and this immunosuppressant was given, but that was also he was not taking because he was worried about the medicine. He had relief. Actually, on the 8th day, he was taking only this rosuvastatin. That also half, it was reduced to half dose. And even with that half dose, his cholesterol parameters was normal, and HDL, when the medicine, this after reducing the statin, his HDL level increased. On the 8th day itself, it has come up to HDL level increased to 45 from 35. And HSCRP, CRP, and everything was reduced. Even the SGOT, SGPT in the 8th day itself came down very much. From 942, SGPT came down to 320, and SGOT came down from 577 to 174. So that was the fast result actually. And the TPO and RA factor and everything, anti-CCP, everything has come down. By the 30 days, he was taught, every medicine was, even by the 15th day itself, he was come out of medication and almost symptom free. Only his knee joint has slight pain. All the other problems was over. And usually the patient, when we go from Kerala and to the other foreign countries, they find it difficult to do the testing. Here in India, we can very freely, test is available, and the cost is very low. But in European countries and all, they had to depend on the NHS and this national health scheme or the insurance. So they will not be able to do this test very freely. So on that 60th day, he was not able to send the report. But by the 90th day, he managed to do some test. It was also fine, and he was symptom free. And after that also, even usually we ask for follow-up every month till 6 months, that is 180 days. And then 270 and yearly checkup. That is the routine, and he is following and he is managing without medication, and he's able to, with the lifestyle correction, with the scheduled exercises and the lifestyle correction, he is able to manage without medicines. Here in clinically supervised and supported lifestyle correction, what we are trying to do is use the healing power of the body by empowering the healing aspect, the anti-inflammatory aspect of the immune system. First is by providing optimal nutrition. Second, by promoting removal of toxins by improving circulation through optimal stimulation of all cells by plant exercise. Third, minimizing toxins entering the body through food, water, air, and cosmetics. Diabetes, hypertension, heart disease, cancer, liver disease, kidney disease, obesity, stroke, allergies, autoimmune diseases, etc. come under the umbrella of lifestyle diseases. 90% of the medications and 90% of the surgeries are for lifestyle disease. This means that 90% of the medicines and 90% of the surgeries can be avoided. It is good to understand that neither medicine nor surgery can cure a lifestyle disease. To put it differently, it is not a lack of medication nor surgery that created the disease. This is why once medication is started, very often both the disease and medicines will keep on adding more numbers along with the unwanted side effects. This is why it is very important for you to understand and correct lifestyle while also encouraging others to do so. Another important aspect is when someone is talking about healthcare and treatment approaches, you should consider the scientific background of the concerned person. I am Dr. Jolly Thomson, started medical education in Government Medical College, Kochi as 1981 batch, and completed diploma and MD in obstetrics and gynecology from Government Medical College, Thiruvananthapuram, Kerala, India in 1992. After additional training in reproductive medicine and surgery, joined government service. Later resigned from the government service, and in 1997 started practicing as consultant in Life Care Center, Kochi, focusing on lifestyle modulation with the clinical support for lifestyle diseases, minimizing the need for medication and surgery. Another important thing every patient should understand is a patient's role in drug pollution. Major part of the medication we take are excreted in the urine, sweat, and stool. It will reach the groundwater, rivers, drinking water, plants, animals, and food products. That means the medication we take is becoming a threat not only to us human beings, but also all the life forms on our planet. Therefore, it is essential to correct lifestyle, reverse lifestyle diseases, and come out of medications. To protect our children, grandchildren, and the coming generations from the ill effects of the toxic pharmaceutical pollution, we should come out of the dependence on medication. The current norm of chronic patient on lifelong medication has to change. Spreading awareness on reversing lifestyle diseases and minimizing medication is the need of the hour. Therefore, remember to share this to your relatives, friends, and colleagues who are on chronic medication or planning surgery for lifestyle diseases. The last few decades of modern medical management clearly shows that medication and surgery cannot cure most lifestyle diseases. Reliable and sustainable solution lies in the lifestyle modulation. To know more about the different lifestyle diseases, treatment options, reversal of lifestyle diseases with clinically supported lifestyle modulation, etc., you may visit our YouTube healthcare channel. Thank you.